Hello everybody. Today we'll be talking about the parotid gland. This is one of the salivary glands that you have in the body, but it's the largest one, and this is where it's situated. Um, we're going to be discussing its details, very specifically the surfaces of it, the parotid duct that goes out of it to release its content within the mouth, and what lies behind it, what innervates it, what supplies it with blood, everything. So before I move on, I would like to, I just wanted to show you how it's situated along with the other structures that may surround it. So if we add the sternocleidomastoid here, 1 second there, it's in close relations in a way um, with so many muscles around, and that's basically how it's shown to be present. Okay, now let me just dive into its details very quickly. First of all, we have, let's just put this as a single page. Okay, that's how basically the parotid gland is found to be situated, and it's on the new book that I've created. It's on page 58 for those of you who have it. So that's how it's mainly situated. We're going to be discussing all the borders, all the contents, the shape of it, everything. So as you guys all may have heard, it is the largest salivary gland in the body, and the site and the extension. So it lies below the auriculars, occupying the deep gap between the ramus of mandible and sternocleidomastoid muscle it extends. So here you see the ramus of the mandible and the sternocleidomastoid muscle, that space between them, and then under the ear. So that's where the parotid gland lies. So it extends upwards to the root of the zygomatic arch, downwards to the angle of the mandible, anteriorly here to cover the masteric muscle, which is the one of the muscles for the mastication. Posteriorly, it overlaps the sternocleidomastoid muscle and medially to the pharyngeal wall. Okay, structure. You have so much to be said about the structure, but mainly I wanted to talk to focus on is the protoduct. It's 5 centimeter long. It rises from the anterior part of the gland, and it goes in and empties its contents at the level of the second molar tooth in our mouth. And this is just, you can stop the video and read about those parts for you. They're all right here for your reading. I just want to move on for the sake of the video. Surface of the anatomy of the parotid gland. We have an upper border, a posterior border, an anterior border. Okay, so we will discuss those quickly here. The upper border, it is somehow close in correlation with the auditory meatus, I will show you later exactly what is in relations with every border. The posterior border is quickly straight line, and is a straight line along the sternocleidomastoid muscle, as I showed you. The anterior border, it in a way surround the masteric muscle, and the anterior border line extends below the angle of the mandible, it also extends to 1 second. So yeah, so it also has a second line that reaches to the tragus of the ear, and so you will see, guys, how this is in a bit. So surface anatomy of the parotid duct, it lies opposite, okay, to the middle 1/3 of a line extending from the lower border of the tragus ear to point midway between the angle of the mouth and the ala of the nose. So you will see that the parotid duct in a way would move in front and then dive in and empties its structure close to the second molar tooth level. So the shape of the gland is basically like that. So that's the anterior part, that's the posterior part, that's the apex and the base. So the base is where I touch right here. The apex is pointing inside So in a way here, the apex is going into the page onto this side. So surfaces, it has lateral surface, anteromedial surface, and the posteromedial surface. So lateral, anteromedial, posteromedial. Borders, as I said, anterior border, posterior border, medial border. And that's the anterior border, that's the posterior border, and the medial border is found inside, and it's not present here. The poles, you have an upper end and a lower end. The upper end, it is in close relations with the exterior of the terminatus, and the lower end lies between the sternocleidomastoid and the angle of the mandible, like we have seen previously. Okay, the posterior border, as we all know, rests on the sternocleidomastoid muscle. The anterior border, the medial border, which is going into the page right now, points directly towards the pharynx and the carotid sheath, and then the anterior border, it's convex forward and gives exit to the parotid duct. So you see here the parotid duct, and the Protoduct continues to give its, as I said, the contents at the level of the second molar tooth. Okay, so now we're going to discuss the relations between the parotid gland and the structures around it. Here, this lateral surface is me basically tapping my face like that, so I'm touching the lateral surface. The anteromedial surface will be the anterior part, and the posteromedial will be the posterior part. So the posterior medial surface, it is irregular and related to the mastoid process, and which is the mastoid process has the sternocleidomastoid muscle attached to it, and the posterior belly of the digastric muscle. Okay, so digastric muscle, sternocleidomastoid muscle. And then also it is in close relations with the styloid processes right here, and the structures attached to it are, I think, are the I forgot, but there's two ligaments, I think, that fixate the temporomandibular joint. I think it's called the stylomandibular ligament, and I really forgot what they are. Just give me a second. Stylomandibular ligament. 1 second. Yes, right here. So they are a stylomandibular ligament, and yes, that's what I remember. I think it's just the stylomandibular ligament attached to the mandible, and there are other stuff attached here, but I don't remember them. But we probably need to know how what's attached here, so that we just say what's in close relations with the posterior medial surface. That's just for more information if you guys would like to. Plus, we have the carotid sheath and its contents, so the intercarotid artery and internal jugular artery, plus the last 4 cranial nerves. So there'll be cranial nerve number 9, glossopharyngeal, cranial nerve number 10, vagus, cranial nerve 11, accessory, cranial number 12, hypoglossal. So if you mention all of those things that are in close relations with the posterior medial surface of the parotid gland, that'd be nice to give him general information about what you know about the relations. Second thing is the relations with the anteromedial surface. We obviously have the posterior border of the ramus of the mandible right here. Okay. Then we have the mastocytic muscle, the medial pterygoid muscle, the maxillary artery emerges from this surface. So you have the 2 muscles, the mandible, and you can mention the maxillary artery. Okay. And so the superficial lateral surface, of course, right here, you have the skin, obviously, is a subcutaneous and related to skin. Also the superficial fascia, which has the platysma, okay? And if you want to mention some nerves, greater auricular nerve and the preauricular lateral nerves, the parotid fascia and few deep parotid laryngeal nerves, I think, embedded in the surface. So These are the surfaces and the structures surrounding or in relation with the parotid gland, so that you know exactly where it's situated. Okay. In relation to the upper end, of course, as I mentioned, the auditory meatus, and you have the temporal branch of the facial nerve, the superficial temporal vessels, and the auriculotemporal nerve. So these are good things to mention for the upper end. Now for the lower end, you have external carotid artery, two branches of retromandibular nerve, and the cervical branch of the facial nerve for the lower end. Relations to the anterior border, and you're going to study this when it comes, I think you've already studied this, the branches that innervate the muscles of the face. They have the zygomatic branch, the transverse facial artery. Oh, sorry. No, so I was referring to the nerves of the face that pass through, yeah, you see, they're here. So you have the zygomatic branch, the transverse, the zygomatic branch, the buccal branch. There are a couple of cutaneous branches that pass through cutaneous innervations that pass through the parotid gland that innervate muscles of the face, also pass through the parotid gland. But here they're mentioning about other structures that are not that, which here you have the zygomatic branch of the facial nerve, okay, transverse facial artery, protoduct, of course, right here, buccal branch of the facial nerve, you see, buccal, zygomatic, and marginal mandibular branch of the facial nerve. So you have those branches, but they're not mentioned all of them here. You can also see the temporal branch, and you can also see the cervical branch, as far as I remember. Okay, these are all things that pass through the parotid gland and emerge through the anteborder. Relations of the posterior border, greater auricular nerve, and the mastoid process. Okay, structures inside the parotid gland. You have the facial nerve, of course, the superficial, the most superficial structure. It enters the gland through its posterior medial surface, divides inside the gland into 5 terminal branches, as I mentioned right here. That's what I was talking about. You have the retromandibular nerve, the external carotid artery, auriculotemporal nerve, the parotid lymph nodes. Okay, so now we're going to discuss the protoduct, and of course it's 5 centimeters long, beginning at the anterior border of the gland, at the most convex part of it. Course and relations, it runs horizontally forward on masteric muscle, finger-like breadth below the zygomatic arch, so just saying how far it is from the zygomatic arch, and parallel to it. So that's the parotid gland, protoduct, that's the zygomatic arc. At the anterior border of the masseter, it turns sharply medially to pierce the following: the buccal pad of the pad of fat, right here, buccal fat pad, the bucopharyngeal fascia, the buccinator muscle, and the mucous membrane, the buccal mucous membrane. So these are things that the parotid gland goes through before it supplies and ends by opening into the vestibule of the mouth opposite to the upper second molar tooth level. Okay. Now you can also, guys, look at the capsule of the parotid gland. There's a capsule that surrounds it. There's a superficial layer and deep layer. You can read more about it by stopping the video. And blood supply to the parotid gland. You have arterial supply. You have from the external carotid artery, that passes through the gland. So you have small branches from there that supplies it. Venous drainage is retromandibular vein. Very important nerve supply, and you can learn about it through the structure of the glossopharyngeal nerve. The glossopharyngeal nerve starts at the inferior salivatory nucleus, and the glossopharyngeal nerve gives off, I think, from either the inferior or the superior. I think the inferior ganglion gives off branches to supply and innervate the parotid gland. And so the glossopharyngeal nerve passes through the jugular foramen first, gives off the tympanic branch of the glossopharyngeal nerve, passes through the tympanic canaliculus to reach the tympanic plexus inside the middle ear cavity, to reach the lesser petrosal nerve that then passes through the foramen valley to reach the otic ganglion. From there, the postganglionic parasympathetic fibers from the otic ganglion joins with the auriculotemporal nerve to innervate it and tells the parotid gland what to do. Yep, so parotid gland, okay? And this is just the summary of what I just said in words. My overeats there. Okay, so you can stop the video and look at it for yourself. but that's mainly the parotid gland and everything you need to know about it in a nutshell. And thank you guys for watching this video. Please like the video, subscribe to the channel for more upcoming things. And if you guys want to purchase this book, it's available. Shoot me a text. Enjoy studying.